Hi, I'm Dr. Hong Vuong, and in this video we will be talking about plantar fasciitis. Plantar fasciitis is basically a tissue that's located at the bottom of your foot. Now, the majority of it is where the arc of the foot is. This tissue is inflamed. As a result, it's also very stiff and rigid. So when you walk, you're basically stretching the plantar fascia out. As a result, it's very painful. And most patient that complains of this pain is worsened in the morning when they first get out of bed, and those first few steps can be excruciating. When patients present with this condition to our office, the first thing that we check for are all the joints in the foot. Make sure they're all freely mobile, and if they're not, what happens is when the joints are not freely mobile, it can cause the plantar fascia to lose its flexibility. As a result, it becomes very rigid and it can contribute to the condition itself. Other things that we have patients do is home exercise, home stretches specifically. Now, the first stretch that we'll be doing is we're going to be seated, and what we want to do is we're going to bring one hand, grab the center of the foot, the other hand will be grabbing the top of the toes, and then we will be pushing the toes upward. When you push upward, you will feel the stretch in the plantar fascia, and you will hold this for about 30 seconds, and then you will release it. When you want to release it slowly, and then you repeat the same thing, push it up for 30 seconds, and then release it slowly. You want to do this for 4 times, so basically 4 sets. After this stretch, we'll move on to our calves. So our next stretch is the calf muscles. Now, to do this one, I like to use the wall as support. So what we'll do is we'll have one leg forward and one leg backwards. The leg that's in the back is the one that's getting the stretch. So as you lean forward, you can feel the tightness on your calf muscles. Make sure your heel of the back leg is touching the ground at all times, because if it's not, then we're not really stretching the calf muscle. So you want to hold it like this for 30 seconds. After 30 seconds, we want to switch. Do the exact same thing. Make sure your heel is touching the ground, and we'll hold it for 30 seconds. And after 30 seconds, we will go ahead and switch back. Now we will want to do the stretch 4 times on each leg. The next 2 exercises that we are going to do will be on the floor with the mat or on the carpet. We won't be doing this on the bed because the bed is too soft. So this is the position for the hamstring stretch. So we'll want to bring both hands on this leg and try to go out, reach out as far as we can. Now, our ultimate goal is to be able to go all the way down to our toes, but not everyone is that flexible. So this is how far we can go. This is how where we will start. And as we make progression, as we gain more flexibility within the hamstring, we can make our way down. And when you do this, you want to hold this for, again, 30 seconds. After 30 seconds, go ahead and do the exact same thing for the opposite leg, and you will hold it again for 30 seconds. And we will be doing 4 sets of these. So that means this side 4 times, this side 4 times. The next exercise we'll be doing is the back, low back stretch. So you want to find a comfortable pillow to rest your head on and start with both legs flat. Now we want to bring this leg up, bring both hands, put it behind your knees, and then pull. You want to pull your knees up to your chest as far as you can, and you want to hold this for 30 seconds again. After 30 seconds, we'll let it go. Bring this knee up, hold it for 30 seconds. After 30 seconds, we want to bring both legs up and pull toward our chest for 30 seconds. After 30 seconds, that's considered as 1 set. So once you stretch this side, and both legs, all those 3 are considered as 1 set. You want to do 4 sets of these. So with the 4 exercises that we just did, we want to make sure that each exercise is done in 4 sets. On top of that, we want you to make sure we do a minimum of 3 times per day. Maybe one time in the morning, once in the midday, and once before you go to bed. If you can do more, that will be a whole lot better for you. So good luck, and we hope you feel well soon. Take care.